Genus Ancylostoma. Genus Ancylostoma. Ancylostoma morphology. The parasite is commonly known as the Old World hookworm. It lives in the small intestine of hosts such as cat and dog and human. It is a small, cylindrical worm, grayish-white in color. It has two ventral plates on the anterior margin of the buccal capsule. Each of them has two large teeth that are fused at their bases. A pair of small teeth can be found in the depth of the buccal capsule. Male are 8 to 11 mm long with a copulatory bursa at the posterior end. Female are 10 to 13 mm long with the vulva located at the posterior end. Ancylostoma. Ancylostoma life cycle. The infective L3 larva penetrate the skin most commonly through the fat. The larva enters the systemic circulation. It is then carried to the lungs, break into alveoli, ascend the bronchi and trachea. The cough up and slowed back into the small intestine, where it matures. The larva later mature into an adult in the small intestine, mainly jejunum, where they attach to the villi, and female worm can lay massive number of eggs per day. These eggs are released into the feces and reside on solid and hatches after 1 to 2 days. These larvae molt twice and become third stage infective larvae within 5 to 10 days. The larvae can then penetrate the exposed skin of another organism and begin a new cycle of infection. Ancylostoma caninum. Ancylostoma life cycle in dog. Cutaneous larva migraine. Cutaneous larva migraine. Egg in faces of animal definitive host. Has reptidiform larva develop in environment. Reptidiform larva develop into infection filariae larva. Animal definitive host. Adult in small intestine. Skin penetration. Migration of larva through skin. Cutaneous larva migraines. Cutaneous larva migraine. Cutaneous larva migraine. Clinical sign. Ancylostoma clinical sign. Abdominal pain, colic or cramping and excessive crying in human infant. Intestinal cramp, nausea, a fever, blood and mucus in feces, a loss of appetite, itchy rashes. Ancylostoma pathogenesis, a light infection causes abdominal pain, loss of appetite and geophagy. Heavy infection causes severe protein deficiency or iron deficiency anemia. Protein deficiency may lead to dry skin, edema and abdominal distension from edema portably, while iron deficiency anemia might result in mental dullness and heart failure. In pregnant women, the parasite infects the fetus and can cause complications such as low birth weight, maternal anemia, and infant mortality. In several cases, there is anemia. Canine hookworm dermatitis, CLM in leg region. Ancylostoma diagnosis. The standard method of diagnosis the presence of hookworm is by identifying hookworm egg in a fecal sample using a microscope. A concentration procedure is recommended because egg may be difficult to find in light infection. Egg of Ancylostoma species. Ancylostoma prevention and control. Education, improve sanitation and controlled disposal of human feces are important. Wearing soy in endemic area can reduce the prevalence of infection and minimize the chances of water itch or ground itch. A duodenal can be treated with albendazole, mebendazole, and benzimidazole. Parenteral pamot is an alternative. In severe case of anemia, blood transfusion may be necessary. Genus Bunostomum. Genus Bunostomum. Genus Bunostomum. Morphology. These are endoparasite of small intestine of large and small ruminant. Bunostomum phlebotomus primarily seen in calf where B trigonocephalum in lamb. They are grayish white worm, 1-3 cm in length and short. Their anterior end is bent dorsally, giving them a hook-like appearance. The buccal capsule is funnel shaped and bordered with a pair of chitinous cutting plates. These chitinous plates serve to attach the parasite to the intestinal mucosa. Bunostomum trigonocephalum life cycle. They have a direct life cycle. The infection occurs through percutaneous route but can also acquire oral infection. Hot water restrict survival on posture to 6-7 weeks, and the larva or eggs do not survive the winter on pasture. The egg taking 24 to 36 hours to hatch and 5 to 60 days to develop into an hatched L3 infective larva. The hatched out larvae then migrate to the lungs and trachea, reaching the intestine after they are coughed up and swallowed. Larvae molt both in the lungs and when they reach the abomasum or intestine. Eggs are shed into the feces by infected individuals. Bunostomum species life cycle. Life cycle in sheep. Bunostomum pathogenesis. Initially, there is diarrhea containing mucus and or blood, anorexia, inappetence, and weight loss or stunted growth are other symptoms. Hypoproteinemia due to parasitic consumption may cause peripheral edema, example bottle jaw. Bleeding and fluid loss often causes anemia, dehydration, and associated pallor, prostration, emaciation, and weakness. Skin infections generally seen in the feet and limbs are pruritus, erythema, oedema, alopecia, hyperkeratosis, and papule or pustule information. The coat in affected area is often rough and poor. Claw and hooves also exhibit defective growth, fragility, and overgrowth. Larval migration through the lungs may also cause a cough and other respiratory signs. Bunostomum diagnosis, clinical signs and symptoms, fecal examination or detection of egg by the flotation technique at necropsy. Adult can be demonstrated in the proximal segment of the small intestine and identify microscopically. Egg of Bunostomum species. Bunostomum prevention and control. It is very important to keep livestock away from moist pasture because infective larvae swim to the tip of the grass blade, from where it is easier to reach the skin of their lost. A dry and clean atmosphere is necessary because humid bedding and dirt favors the development and survival of infective larvae. Alternate grazing, example cattle followed by sheep or horse within 2-3 month interval, can help reduce pasture contamination with Bunostomum worm. As a general rule, is reduction in pasture contamination with infective larvae, example adequate pasture rotation or exposure of livestock to such larvae will diminish the impact on the herd. Thank you.